My name's Veronica, and I work here at the Aboriginal Health Council as Sexual Health Program Officer, and I've been here for 8 years, very proudly to say, yeah.
My name's Sunni, and this is my third day at Aqua as a Sexual Health and Bloodborne Virus Program Coordinator, but I spent 7 years working in remote Aboriginal communities up north in the Kimberleys.
So Sunni and I got together and we thought, gosh, where do we start with, women's health, because there's so many topics. But we thought, it's so important for women to look after their bodies, take charge of their bodies, and look after their baby bags or their wombs. So we thought we'd start with the reproductive system, and how we can look after that. So with that, we've got, it's so important for women to have their Pap Smear, or it's now called a cervical screen, and to have that every 5 years. And what that does is it actually prevents cancer of the cervix. As uncomfortable as it is, and none of us like having it done, no, it's 5 minutes really of your time that could save your life. Yeah. And we would just really encourage women to start having their screens from the age of 25.
And it's once every 5 years now instead of every 2 years, depending on the result that you get, which is good. And also if people are quite behind with getting their testing done, there's also the option for them to be able to collect the swab themselves. So if that's the barrier to them getting tested, they're now able to overcome that by collecting their own sample. The clinician can discuss that with them. Which is
really, really important. And also too, we have a wonderful prevention available for cervical cancer, and it's the HPV vaccination. So HPV is a virus that actually causes 90% of cervical cancer. So it's such an important vaccination, and you need 2 of them 6 months apart, and they're given to kids at school in year 7, both boys and girls. And what we're finding is that a lot of young women and boys actually too are not coming and having their second one, but you need the second vaccination to really get that full cover. So my advice would be, or our advice would be, to, if you've missed your second one, come into one of our Aboriginal medical services, or go see your GP, or rock up into community health, and they can give you advice as well, and have your second vaccination. It's really, really important. And
we want women to feel comfortable taking charge of their health and being the boss of their body, and we want people to model that and teach it to the children as well. That's really important for their safety and for their health. And so we also encourage people, and especially the youth, to get checkups at the clinic and make sure they are free from diseases that can cause complications and blockages in their womb or the reproductive organs that might make it hard for them to have babies when they get older. So that's a really important thing too.
So having like a test for sexually transmitted infections, or I think most people know it, as STIs. It's not like you have to, show all your private parts, and it's done just with a wee in a pot, or a kumbo in a little pot, and some, maybe a swab you can do yourself. It's done privately, and that tests for sexually transmitted infections. And then we're also asking for, for you to give a bit of your blood, and that will check for syphilis. Yeah. So syphilis is another STI, and we've actually got an outbreak of syphilis happening throughout WA and actually across Australia. So, and we're particularly worried about syphilis, aren't we?
Up north they call it a syphilis sickness, and they were really good at getting a blood test taken and making sure they're healthy and they don't have any germs, because they can hide inside you and you don't have any symptoms. You don't realise that you've got something, and it can actually cause a lot of damage to you or any babies that you might have if you want to be pregnant or are pregnant as well, which is really important. We had a lot of great support from peers in community where I worked, and the girls would come in with their friends, and they can stay for part of the consult. They can go out for part of the consult depending on what the client feels most comfortable with, and they were really good at doing that, because it is quite intimidating when you're younger, But and that can help, or sometimes they would even come in a large group. So hopefully clinicians can chat to them in a large group and give them some education, and then speak with them just in private, just for the talks about more intimate details.
Yeah, absolutely. And even for the cervical screen, bring somebody in with you to sit with you, and that's absolutely fine. I think it's a great idea. Even for Sunni and I sitting here, like, how much better does it feel just having each other, like, to be able to yarn about women's health? I just think it's a great way to operate, is bring a friend, bring your family. Yeah. We just would like to really encourage young women to come to our health services just for their routine checkups. It doesn't have to be for anything in particular that's wrong, but just coming in and having a routine check. Or if you're coming in for something else, actually saying, you know, while I'm here, is it okay if I get checked for my cervical screening? Maybe if you need a HPV vaccination, you know, I've had unprotected sex, can I have an STI test? You can have my bloods as well, and we can do the whole lot. And, you know, we just absolutely love it when somebody comes in and actually says, you know, I really want to take charge of my body and I want to get all my checks done. And if you don't ask yourself, well, we'll offer it to you, because we offer it to everybody, and it's not just because we're offering it to you. We actually say, you know, this is something we offer to every woman that comes into the service, particularly if you're aged between 15 and 30. We'd love to be able to offer you these checks. Yeah.